Good day and Assalamualaikum to each and every one of you. I am Rahadia M. ULANGKAYA from BSSW3C and I am the second reporter of the Group 14. So for my discussion, I'm going to tackle about the context of therapy until the modification of cognitive content or cognitive process. So before I proceed with the main discussion, let me break down the overall objectives for the whole discussion. Number 1 is to understand the context of therapy. Number 2 is to analyze patient variables. Number 3 is to identify therapist variables. Number 4 is to conduct effective assessment. Number 5 is to apply CBT-based intervention strategies. And lastly is to understand the goal of cognitive modification. So please take time to read what's on the PowerPoint presentation while I am providing you informations and explanations. So starting with the context of therapy, we have the typical referral path. So paano nga ba napupunta usually ang isang tao sa CBT, especially kung may psychosis siya? So most of the time, it starts sa general practitioner, yung family doctor, or minsan diretso na sa emergency room, lalo na kung urgent yung case. After that, i-refer sila to mental health services. So by the time na dumating na sila sa CBT, of course, may team na sila, kagaya ng psychiatrist, case manager, and minsan meron ding social worker. So they are also probably taking antipsychotic meds na rin. So kapag therapist ka, you're not starting from zero, of course. You're working with other professionals and you also need to be aware kung ano na yung support na meron si patient. So next is the flexibility of service delivery. So CBT is actually very flexible in terms of where it can be delivered. So hindi lang siya pang clinic or pang hospital. Pwedeng gawin ito sa outpatient centers, sa community health centers, or even sa bahay ng pasyente na mismo. So like kagaya sa UK, sobrang common na ang house visits as therapy. And you know what? Mas effective actually siya minsan kasi the patient feels more safe and more comfortable in their own space. So the main point here is the more flexible the system, the more likely na si patient ay mag-a-attend ng sessions and ma-engage talaga sa process. So diba, if the system adjusts to the patient, of course, mas gumagana ang therapy. So next we have the duration and structure. So when it comes to structure, CBT for psychosis usually lasts around 20 sessions. Pero hindi pa ito fixed. Meron pa kasing intensive treatment na matatapos in 3 months and meron din namang less intense na umaabot ng 9 months or more. And then may mga tinatawag rin na booster sessions, so para siyang follow-up or maintenance para lang ma-refresh yung coping skills nila. Ang pinaka-importanting point dito is wag natin i-box yung therapy. So, hindi siya one size fits all. Ang basis ng structure ay dapat ay clinical need or meaning ano ba talaga yung kailangan ng pasyente. So, minsan kailangan nila ng longer support or minsan mabilis silang nag-i-improve. So, be flexible. Goals of CBT for psychosis. So let's be real, CBT is not a magic fix or cure for schizophrenia. Pero sobrang helpful siya when it comes to managing symptoms. The therapy helps patients understand what they're going through, like kagaya ng voices or yung delusions, and teaches them how to cope. So the goal is to reduce distress, help them function better sa daily life, and give them back a sense of control. So, of course, hindi mawawala agad yung symptoms, but the patient learns na hindi siya powerless. Ang ganda ng transformation when they start to realize na kaya pala nilang i-handle yung mga experiences nila. Managing comorbid conditions. So, another thing na kailangan nating i-consider is that patients with psychosis usually have other problems too. Like, they might be dealing with depression, anxiety, hopelessness, or kahit yung mga suicidal thoughts. So, hindi pwedeng diretso agad sa CBT for psychosis kasi kailangan mo na silang tulungan with those urgent concerns. So, for example, kung sobrang depressed na si patient, baka wala pa siya sa mindset na kaya niyang harapin yung hallucinations niya. So, as a therapist, ikaw yung mag-a-adjust. You start where the patient is, not where the textbook says you should be. Group versus individual therapy. So now let's talk about format. CBT can be delivered individually or in a group. So group therapy is nice kasi yung mga patients, they get to share with others, and sometimes yung vibes niya is parang support groups na rin. And they realize na, I'm not alone pala sa ganitong experience. So with that thought, it boosts their self-esteem. But based on research, when it comes to reducing actual psychotic symptoms, individual CBT is actually more effective. So sa group kasi, yung benefits like better self-image, nandyan yan. Pero yung deep changes, mas nakukuha yun siya sa one-on-one therapy. So if severe ang symptoms, individual sessions are usually preferred. Role of family interventions. So of course, let's not forget how powerful families can be in this process. So may mga pasyente na sobrang laking tulong ng pamilya nila, either emotionally, financially, or even just as a support system. So may tinatawag na family interventions, where the family also gets educated and involved sa therapy. So this reduces relapse, helps build a more peaceful home environment, and keeps the patient on track. So may ibang therapists who combine CBT with family sessions. So parang tag team na rin yung nangyayari. So but of course, hindi lahat may supportive family. We all know that. So some patients live alone or estranged. So again, we assess case by case. Lastly is the clinical implications. So what does all of this mean sa clinical practice? So basically, it means don't stick to a script. Huwag masyadong rigid. So, therapy should be flexible, collaborative, and patient-centered. Hindi natin dapat i-expect na lahat ng patients will fit into one perfect program. So, kailangan nating i-adjust ang approach based on their current situation, needs, and resources. And most of all, we have to build trust. Kasi kung walang trust sa therapist, walang progress. So, ang pinaka-goal natin is to create a safe, supportive space where the patient can actually start healing. So, to wrap it all up, CBT is actually effective, pero mas effective siya when delivered in the right context. That means, dapat naaayon sa sitwasyon, support system, at mental state ng pasyente. So we need to be flexible, adaptive, and sensitive, because therapy isn't just about following a treatment manual. It's about connecting with real people, understanding their struggles, and helping them find their way back to stability one session at a time. So let's proceed to our second topic, which is the patient variables. So we have schizophrenia is heterogeneous. So let's start with the big picture. Schizophrenia, as we know, is just not one thing. It's super heterogeneous, meaning very diverse yung presentation niya. A patient can have hallucinations, delusions, cognitive issues, emotional flatness. Lahat yan pwedeng iba-iba sa bawat individual. Now, the sad truth is, kahit may antipsychotic medications, around 20 to 45% ng patients don't respond well to them. And 5 to 10% actually get no benefit at all. So kahit sobrang daming improvement sa medications ngayon, they're still not enough for everyone. That's where CBT comes in. It becomes a crucial option, lalo na for those na hindi nagre-respond sa gamot. Challenges in predicting CBT response. So ang problema lang, even CBT, hindi siya guaranteed na mag-work sa lahat. And right now, wala pa tayong solid way to predict exactly which patients will respond well to the therapy itself. So, ang dami pang overlapping terms like treatment resistance, incomplete recovery, and treatment intolerance. And minsan nagkakagulo siya sa clinical judgment. Kaya ang mga researchers like Tarrier and Wykes, sinasabi nila na yes, CBT can be very effective, pero kailangan pa nating i-refine how we identify and tailor treatments para mas fit sa bawat pasyente. Next is factors linked to poor CBT outcomes. So now let's talk about the traits na usually linked to poor response in CBT. So one big factor is the presence of negative symptoms like affective flattening, which means na parang wala na silang emotion, or alogia, na parang sobrang limited magsalita or mag-express ng thoughts. So these symptoms make it really hard for a patient to engage in therapy. Like if even if gusto mo siyang kausapin, wala ka masyadong makukuha na informations. So, also, kapag mataas ang level ng cognitive impairment like poor memory, concentration, or logic, nahihirapan silang mag-process ng CBT techniques, especially yung cognitive restructuring part. Kung merong poor CBT outcomes, meron namang factors linked to better CBT outcomes. So on the other hand, may mga trails din naman na associated with positive outcomes sa CBT. So for example, patients who are younger tend to respond better. Maybe because mas fresh pa sila sa illness or mas adaptable pa. Shorter education of illness is also a big plus kasi mas maaga mo silang matutulungan before symptoms become ingrained. So, next is may pre-existing coping ability rin, meaning kahit before therapy, marunong na silang mag-handle ng stress in small ways. And clinical and cognitive insight is super important. Like, they know na may pinagdadaanan sila and they're open to understanding it. And lastly, milder symptoms, higher education, better daily functioning, and openness to hypothetical contradiction, yung parang sinasabi na baka nga may ibang explanation sa thoughts ko, it also contributes to success. So next is summary of good prognosis patient profile. So based sa mga findings, ito yung usual profile ng pasyente na mas likely mag-respond sa CBT. So number 1 is young, maiksi pa lang ang duration ng illness, mild to moderate symptoms lang, insightful and aware of their condition, may capacity to reflect and question their thoughts, functioning well in daily life, may educational background na helpful sa understanding the therapy process. But again, this doesn't mean na pag wala ka ng traits na yan, hindi na mag-work ang CBT. It just means na these traits give you a higher starting point. Now let's go to one of the biggest challenges sa clinical practice, the issue of treatment dropout. So, ito yung mga pasyente na uma-attend ng ilang sessions and then nawawala na lang bigla. So, based on studies, may mga common characteristics ng mga dropouts. Number 1 usually is mga lalaki, single, unemployed, and with lower education. Mababa rin ang premorbid IQ, which means even before pa sila nagka-illness, mababa na ang cognitive baseline. Next is mahaba na ang duration ng illness, pero during therapy, hindi naman sila severely symptomatic. So parang okay naman on the surface, pero hindi sila nagtatagal sa treatment, and that's a very big problem. So next is the psychological profile of dropouts. So psychologically speaking, patients who drop out still experience hallucinations and delusions. So madalas silang paranoid, not necessarily suspicious of the therapist, but generally may distrust or anxiety. So some of them are also depressed and hopeless, which affects their motivation na magpatuloy. Pero ang pinaka-common mindset nila is, wala namang kwenta tong therapy or hindi ko kailangan yan. So as therapists or mental health workers, it is important to challenge that belief early on. So kailangan nating ma-build ang trust and show them that CBT can actually help kahit na parang hindi obvious sa simula. Clinical implications. Okay, so what does this mean in real life? So first, we need to do a thorough assessment. So, check if the patient has insight, if kaya ba niyang mag-commit sa sessions, and kung kailangan muna ng other interventions like motivation building. So, second is tailor the CBT approach. Hindi mo pwedeng ipilit ang full model sa lahat. For some, start muna with building rapport and simple behavior strategies before cognitive techniques. Third is to involve the family if possible. Kasi added yung support na yan na makakatulong sa progress ng pasyente. And finally, be flexible. Be ready to slow down, simplify, or shift directions depending sa situation ni patient. So therapy is not a race, it is a partnership. So patient variables matters a lot. Kasi hindi lang to about giving CBT and hoping for the best. We really have to consider the age, background, insight, motivation, and other personal factors ng pasyente. So those with better insight, higher functioning, and more openness, sila yung most likely or more likely to succeed. Pero even those na challenging, kailangan din natin silang i-reach through flexibility and creativity. And most of all, kailangan nating tandaan na just because a patient is struggling doesn't mean they can't improve. It just means na we have to meet them where they are. So moving on, for our third topic, we have the therapist variables. So what are the therapist variables? Basically, ito yung mga traits or factors related sa therapist mismo. Like, gaano siya ka-train, gaano siya ka-experience, yung competency niya sa CBT, kung may regular supervision ba siya, at yung personal style niya, like how warm or flexible they are. So, all of this affect kung magiging effective ba ang CBT, especially para sa mga pasyente na may psychosis. So, why therapist experience matters? So, now treating someone with psychosis isn't exactly a light work. And it is complex, and usually patients also have other issues like anxiety, trauma, depression, or even addiction. So dapat ang therapist is handa siya na mag-handle ng mga ganong cases. Kaya hindi pwede na basic training lang ang background. Para talaga maka-adjust sila sa different symptoms and clinical needs, so therapists need both skills and experience. Kailangan may confidence at clinical judgment sila to decide what's best for the patient in the moment. Risk of minimally trained clinicians. Here's the thing. In some health systems, gusto nila makatipid, so they assign complex therapies to minimally trained clinicians. At first glance, parang okay lang, but in reality, this can be actually a big mistake. Kasi CBT for psychosis isn't plug and play. Hindi ito tipong basta may manual go na. So therapists need a deep understanding of what's going on in the patient's mind and must be able to respond to complex or unexpected reactions. That's why proper training and experience really matter. Best practice, full-time CBT therapist. So according to study by Steele et al. In 2012, mas maganda talaga ang outcome kapag yung therapist ay halos buong time nila nakafocus sa CBT for psychosis at also meron silang frequent clinical supervision. So ibig sabihin, kung full-time CBT therapist ka at regularly ka rin nagsusupervise, mas updated ka sa techniques and mas supported ka in practice. So hindi lang siya journey, may feedback loop na nakakatulong to improve outcomes. Beyond the manual, flexibility is key. So although may CBT manuals and structured treatment plans, ang treatment for psychosis shouldn't be too rigid. Bakit? Kasi ang bawat pasyente ay iba-iba. Some might respond quickly, others might struggle with trust or insight. So yung therapist should know when to stick to the model and when to adjust. Hindi pwedeng robot lang na sunod lang sa steps. Kailangan marunong magbasa ng situation, mag-adapt, and even use creative clinical strategies. Therapist competency and prioritization. Also, therapist competency isn't just about following the CBT model. It's about recognizing what to treat first. Halimbawa, may psychosis nga si patient, pero sobrang taas ng anxiety or suicidal risk. Anong uunahin mo? So the therapist must be able to prioritize, plan, and decide case by case. At syempre, may mga pasyente na emotionally intense or medyo hard to handle. So you also need patience, composure, and clinical empathy. Therapist qualities that matter. Aside from skills and training, personal qualities of the therapist also matter. Like, kailangan mo maging warm and empathetic, consistent and reliable, patient and respectful. So, patients with psychosis may be suspicious, withdrawn, or scared. So, yung therapist should really know how to build trust and engage them without being pushy. Like yung parang namimilit. So, studies show na kapag walang good therapist-patient relationship, treatment outcomes suffer. So yes, connection is the key. What experts say, the Delphi study. So experts in CBT actually agreed on what makes therapy effective. based on a study using the Delphi method, which is basically a structured expert consensus. Ito yung mga top essentials. Number 1, a solid detailed assessment, use of cognitive models and formulation, effective implementation of change strategies, and yung attitude, of course, ng therapist, like being non-judgmental, and using normalizing rationale, meaning explaining symptoms in a way na magme-make sense siya sa patient. So all of this help in making the therapy more accessible and less scary for the client. So to summarize, therapist variables play a huge role in the success of CBT for psychosis. So hindi lang importante kung anong techniques ang alam ng therapist. Importante rin kung paano niya ito ina-apply, gaano siya ka-train, kung may supervision ba siya, and kung paano siya makikitungo sa pasyente. So, with the right mix of skill, experience, empathy, and flexibility, CBT becomes more effective and more impactful for patients who actually really need it. So, we're now at the fourth topic, which is the procedure of CBT, the Manchester model. So, just a quick overview. The Manchester model was created by Tarrier, and it follows the coping recovery model. Compared to other CBT models na medyo curative ang goal, this one accepts the possibility that psychosis might be long-term. Instead of focusing on removing symptoms completely, the therapist helps the patient live with the symptoms in a more manageable way. So yes, CBT techniques are still used, like changing the thoughts, behaviors, and even attention. But the overall goal is recovery through coping, not curing the illness. Very empowering siya, especially for those na matagal nang nagka-psychotic symptoms. Coping versus curing. So let's dive into one of the most important points. So dito sa model na ito, the therapist and the client work together not to eliminate the illness totally, but to make it more bearable. Halimbawa, may voices pa rin or delusions, pero the person learns how to manage their reactions to it. So, hindi nila hinahayaan na makontrol sila ng symptoms. It's a more realistic approach, especially sa cases where yung symptoms is maaring bumalik. The model accepts that there are limits to what therapy can do, but it empowers the patients to regain a sense of control sa buhay nila kahit may ongoing difficulties. Now, let's talk about the internal and external factors. So, what causes or worsens the psychosis? This model says na may dynamic interaction between internal and external factors. So, sa internal, this include yung mga biological and psychological traits like genetics, brain chemistry, and even cognitive skills. So, pwedeng namana ito or nakuha from experiences. So, sa external naman, ito naman yung environment. So, kagaya ng stressful relationships, over-demanding situations, or traumatic events. So, kapag vulnerable ka internally, tapos may outside stress pa, mas tumataas yung risk for psychotic symptoms like hallucinations or delusions. Kaya holistic yung approach ng model kasi it considers both inside and outside influences. Dysfunctional processing and appraisal. So, ito na yung part kung saan pumapasok yung interpretation ng psychotic experiences. For example, someone hears a voice. Ang unang instinct is to appraise it. Like, for example, saan galing yun? Anong ibig sabihin nun? So, that's called primary appraisal. Then comes secondary appraisal, where the person thinks, anong epekto nito sa akin? Safe pa ba ako? So, sadly, many times, the interpretations are negative or threatening. So, ang feeling nila is danger or they might feel crazy, rejected, or unsafe. So, this leads to strong emotional reactions like fear, anxiety, or panic. Tapos, nagkakaroon sila ng coping behavior like isolation or avoidance. Multidimensional reactions to symptoms. So, what makes psychosis really complicated is that the reaction isn't just mental. So, it affects all the aspects of a person. So, emotionally, the person might feel intense fear, anger, or sadness. Behaviorally naman, They might avoid people, stop going out, or even do risky things. And cognitively, they develop beliefs like parang sinusundan sila or someone is watching them. And lahat ng reactions na yan, instead of helping, minsan lalo pang nagpapalala sa sitwasyon. So halimbawa, avoidance can lead to isolation, which then confirms their paranoid beliefs. So parang cycle siya that just keeps going. Feedback loops and maintenance. So how are these symptoms maintained? Through what we call feedback loops. So let's say the person hears a threatening voice and reacts with fear. So that fear leads to anxiety, which increases arousal. Ibig sabihin, alert na yung katawan nila. Pero high arousal affects brain function. So mas nagiging prone sila sa hallucinations or delusions. Tapos kapag they act on these fears, like nag-walk out sila or nag-away, they experience even more stress or trauma, and that maintains the psychotic experience. So instead of breaking free from it, they're caught in a loop. So next is the EBAC cycle. So one major part of this model is called again the EBAC cycle, which stands for letter E, experience, like for example, hearing a voice. Letter B, belief, for example, interpreting that voice as a threat or something that is meaningful. Now, letter A is action. For example, is reacting to that belief, like hiding or confronting someone. And letter C is confirmation. For example, the belief becomes true in their mind dahil sa action nila. So again, uulitin ko lang. EBAC stands for E, experience, B, belief, A, action, and C, confirmation. So for example, if they believe people want to harm them and then they avoid everyone, they never get to see na hindi naman totoo yung fear. So this cycle keeps repeating and strengthens the belief. So that's why it is crucial to interrupt this pattern para matulungan sila to think more clearly and behave differently. Goal of CBT in the Manchester model. Now, what does CBT aim to do in this model? Ang goal is to help the patient cope better by disrupting the EBAC cycle. So, paano? Number one, by changing how they appraise the experience. Baka hindi naman totoo yung iniisip ko, something like that. Number two, by modifying their behavioral responses. Sige nga, subukan kong lumabas ulit. Number three, by addressing the emotional responses, like teaching them how to manage anxiety or fear. So, hindi man mawawala totally ang symptoms, at least nababawasan ang distress and dysfunction. So, let us now proceed with the assessment. So, we have goals and importance. So, the first stage in CBT is assessment. And sobrang crucial ito. Hindi enough na alam lang natin na may symptoms si client, like hallucinations or delusions. So, we need to understand the full story behind it. Kung bakit siya nagkakaganon, ano yung possible triggers, and paano siya nagre-react sa symptoms niya. So, assessment helps us answer questions like what thoughts come before or after the symptom, anong ginagawa ng client to cope, does it help or does it make things worse. So, we usually use clinical interviews, self-report tools, and minsan behavioral observations para makuha ang clearer picture of the client's day-to-day life. Through assessment, we can start connecting the dots, like what triggers the psychosis, what maintains it, and how we can design a treatment plan that's really aligned sa mga kinakailangan nila. Recommended tools. So, clinicians often use tools like SIRATs para ma-measure ang intensity, frequency, and distress caused by symptoms. So, meron ding antecedent and coping interview na semi-structured. Dito naman ina-assess ang mga trigger ng symptoms, beliefs ng clients about them, emotional reactions, and paano nila kino-cope on a daily basis. So, mas personalized talaga yung formulation. What the ACI covers. So, yung ACI or Assessment of Cognitive Insight is super useful sa CBT kasi it helps build a full and personalized picture of the client's psychosis. So, it's not just about listing symptoms. It's also about understanding how the psychosis affects them emotionally, mentally, and behaviorally. So, like, paano sila mag-isip, ano yung emotions nila around the delusion or hallucination, paano sila kumikilos because of it. So, for example, kung nagiging anxious sila, baka nagde-develop sila ng avoidant behaviors, like ayaw na lumabas ng bahay or hindi na nakikipag-usap sa iba, or may safety behaviors like always wearing headphones to block out voices. So, these behaviors, while understandable naman, sometimes unknowingly maintain the delusions. So through the ACI, the therapist gets a deep and clear understanding of what's really going on. And that insight helps guide kung paano i-structure yung treatment, coping strategies, and goals ng CBT. So let's now proceed to the intervention, the CBT and coping strategies. So after makuha na ni clinician yung full picture ng situation ng client, through assessment and understanding their symptoms, the next step is to share this understanding with the patient. So dito, the therapist explains the CBT approach in a way that makes sense to the client, gaya ng sabi ko kanina. So they clarify that the main goal of CBT is not necessarily to cure the psychosis, but to teach the client how to cope with the symptoms and reduce distress. So, kasi, let's be real, some clients are still fully convinced na totoo yung delusions nila. And in CBT, we don't force them to change their belief. So instead, we work on how they respond to those beliefs. So for example, instead of panicking or isolating, they learn to manage their emotions, stay grounded, and keep functioning. So the heart of the intervention is, let's not argue about what's real or not. Let's focus on how to help you feel better and stay in control. So and through that, coping becomes the bridge to long-term recovery. Characteristics of CBTP coping training. So what makes CBT for psychosis or CBTP unique is its focus on coping training. So it's not like a generic program na same for everyone, because it is highly personalized based on the client's own experiences, thoughts, and symptoms. Also, hands-on talaga siya. Hindi lang puro talk therapy. Meron ding role-playing, simulations, and real-life practice of coping skills. So like, kung ang client ay natitrigger sa crowded places, pwedeng i-practice yun step-by-step during sessions or as a homework. And the best part, with consistent practice, these external coping skills become internalized. Ibig sabihin, yung mga techniques na una nilang ginagawa with the therapist, eventually nagiging automatic na. So part na yon ng daily thinking pattern nila. So the goal is not just to survive each symptom, but to build long-term mental habits that actually support recovery. Types of coping strategies taught. So anong klaseng coping strategies ba talaga ang tinuturo sa CBT para sa psychosis? So usually these fall under three main areas. Number one is cognitive process, cognitive content, and behavioral strategies. So each area targets a specific aspect ng experience ng pasyente para matulungan siyang i-manage ang symptoms niya in a more effective and less distressing way. Number one is the cognitive process strategies. So ito yung mga techniques na tumutulong sa pasyente na baguhin kung paano sila mag-isip or paano nila pinoproseso ang thoughts nila. So for example, kapag ang pasyente ay sobrang nakafocus sa isang delusional thought or sa isang distressing hallucination, we teach them how to distract themselves or switch their attention to something else. So pwede yung grounding techniques like focusing on what they can hear or feel, or doing a task na engaging like drawing or solving puzzles. So ang goal dito is not to ignore the symptom completely, but to help the person realize that they have some control over how much they engage with it. So instead of spiraling or panicking, they can learn how to shift out the distressing moment. Number two is the cognitive content strategies. So ito naman ang tumututok sa mismong nilalaman ng thoughts, specifically challenging delusional beliefs or irrational interpretations. So for example, kung may patient na naniniwala na may tao sa paligid na gustong saktan siya, the therapist gently asks question like, what evidence do you have, or have you ever been harmed when you felt this way? So this process is called reality testing or Socratic questioning, and it encourages the patient to see their thoughts not as absolute truths, but as hypotheses that can be explored. Over time, this helps them develop insight and reduce power ng delusions sa daily functioning nila. So it's not about convincing them na mali sila, but it is about planting seeds of doubt in a safe and respectful way. Number three is the behavioral strategies. So ito na yung practical, action-based interviews na tumutulong sa pasyente na bumalik sa normal routines or activities na iniiwasan na nila because of fear, paranoia, or negative symptoms. So for example, may pasyente na hindi lumalabas ng bahay dahil iniisip niyang everyone's watching him. So sa therapy, gradual exposure is done, starting from standing by the door and then walking outside for a few minutes hanggang unti-unti na siyang makakapunta sa grocery or cafe. So behavioral strategies also include activity scheduling, assertiveness training, or social skills training. So para ma-regain nila yung confidence to interact, work, or do daily tasks again. So these strategies aim to break the cycle of avoidance and reintroduce structure and meaning sa life ng pasyente. So we're now on our fifth topic, which is the cognitive coping strategies. So first coping strategy is called attention switching. So dito, tinuturuan si client kung paano mag-shift ng focus kapag nagsisimula na silang makaranas ng delusional thoughts or hallucinations. So, kasi diba, once na nagsimula na yung voices or disturbing thoughts, automatic na yung mind nila na nagsispiral. So what we want is to interrupt that cycle early. So paano? By teaching them to focus on something neutral or positive instead. So for example, sabihin na natin, meron siyang favorite memory, like kumain siya sa isang restaurant, sa Jollibee. So during sessions, pinapractice nila to mentally replay that moment. Like kung anong itsura ng lugar, anong amoy ng pagkain, naririnig ba niya yung clinking ng utensils or ambient music. So the more detailed, the better. So eventually, namamaster na yung scene to the point na kaya niya na itong i-recall anytime. So kapag nararamdaman na niyang paparating ang hallucination or intrusive thought, ginagamit niya itong memory as a mental anchor. So para siyang mental safe space. So it is super helpful kasi it grounds them back to reality and gives them a sense of control over their mind. Kaya attention switching is one of the go-to strategies for early symptom management. The next strategy is called attention narrowing. So this one's super useful rin for clients na easily overwhelmed, like those sabay-sabay na nakakarinig ng voices, intrusive thoughts, or sobrang daming external stimuli. So sa schizophrenia, one common struggle is not knowing which thoughts or sensations are real, important, or safe to focus on. So the goal of this technique is to train the brain to filter para hindi lahat ng stimuli ay pumapasok agad sa awareness nila. So how do we do that? Clients are taught to narrow their attention to just one specific thing. So pwede itong isang tunog, like the sound of a clock ticking, or isang visual, like focusing on the flame of a candle, or even a single activity like slowly sipping water and focusing on the taste. So minsan, tinuturuan sila na mag-blank muna ng mind or deliberately pick just one thought to hold on to habang pinapalampas yung iba. So next, so number 3 is the modified self-statements and internal dialogue. So this time, we focus on self-talk or yung mga sinasabi nila sa sarili nila. So the goal is to create new, helpful statements na ginagamit every time may negative thought, hallucination, or fear. So for example, if may voice na nakakatakot, instead of reacting, sasabihin mo, I don't need to be afraid. Or kung paranoid ka na someone is looking at you, bakit ko iniisip na tinitignan niya ako, di ko naman siya kilala. So at first, verbal siya, like talagang sinasabi out loud. Pero as time goes on, it becomes internalized. So ginagawa rin to during role-play sa sessions so the patient practices in imagined scenarios. So eventually, they develop this mental voice that helps them grounded. Number 4, we have the reattribution. So ito yung part na tinuturuan si patient na bigyan ng ibang explanation yung experience niya. So instead of thinking na totoo yung naririnig ko, we encourage them to think na maybe it feels real, pero baka thoughts ko lang to. So dati ginagamit pa yung it's because of your illness na reasoning, pero hindi siya helpful for all, di ba? So now we use we use statements like it may seem like someone's talking to me, but it's just in my head. Or kung may bosses man na nagsasabi ng anything na crazy stuffs, the patients can think na, bakit ako naniniwala? Puro nonsense naman ang sinasabi. So this way, they start questioning the power and truth behind their symptoms and slowly regain control. Next is the awareness training. So awareness training is all about teaching patients na maging conscious or aware sa mga sintomas nila. So lalo na yung mga positive symptoms tulad ng mga voices or hallucinations. So the point is para maramdaman nila agad kung kailan nagsisimula yung symptoms nila. So tapos instead na ma-freak out sila or masyadong maapektuhan sa mga bosses, they learn to just notice them without reacting emotionally. So parang like, okay, naririnig ko to, pero hindi ako nagpapa-apekto. So they focus more on how the voices or thoughts come in. Yung form, not so much sa content or meaning ng sinasabi ng voices. But for example, if maramdaman nila na may boses na nagsisimula, they can switch their attention away para hindi sila ma-overwhelm emotionally. So it's like mental distancing para di sila totally stuck sa mga negative experiences nila. Tapos, pwede nilang gamitin yung symptoms as a sign to do something else, just like distraction or coping activity. Next is the arousing technique. So dito naman tayo. This is super important kasi pag sobrang taas ng stress or anxiety, lalo talaga lumalala yung schizophrenia symptoms, di ba? So like, mabilis sila matrigger ng hallucinations or delusions kapag mataas yung emotional arousal nila. So kaya talaga, part ng therapy na matutunan nila paano ikalma agad kapag ganun ang nangyayari. Pero ang ayaw ng therapist is yung sobrang haba or complex na relaxation exercises kasi first, nakakawalang sense sa actual situation, tapos pang matagalan pa kaya minsan hindi nila nagagamit. So hindi naman practical, lalo na kapag nasa stressful na situation sila na kailangan talaga ng quick relief. So instead, simple at mabilis na paraan lang tulad ng deep breathing, parang inhale, exhale, like ganun lang. O kaya naman pag-upo lang ng tahimik imbes na mag-pacing or maglakad-lakad ng walang direksyon, nakakatulong talaga. Meron ding quick relaxation techniques na madaling matutunan at magagamit kahit saan. So basically, tinuturuan silang mag-chill agad para hindi lumala ang emotional tension nila. Kasi pag mataas yung arousal, mas madaling mag-trigger yung symptoms. So next is the increased activity levels. So alam nyo, maraming patients na may schizophrenia kasi kapag inactive sila, mas lumalala yung symptoms nila. Kasi wala silang distraction, tapos sobra silang nag-overthink, which makes everything worse. Kaya isa sa mga pinaka-effective coping strategies dito is yung pagiging busy or yung pagtaas ng activity levels nila. So simple lang naman to actually. Pwede magplan ng daily activities, kahit mga simpleng hobbies lang na kaya nilang gawin araw-araw. Just like paglalakad, pagtatanim, drawing, or kahit anong bagay na mag-engage sa isip nila. So kapag may ginagawa sila, parang nagkakaroon sila ng dual task na competing for their attention. Meaning, hindi na sila masyadong nakakatutok sa mga voices or delusions nila kasi distracted na sila sa mga ginagawa nila. So ganun din, nakakaiwas sila sa mga situations na nag-worsen ng symptoms. Kasi minsan kapag bored or nag-iisa, lumalabas yung mga negative thoughts or hallucinations. So next is social engagement and disengagement. So medyo surprising pero social interaction talaga is nakakatulong sa mga patients. Lalo na sa may mga schizophrenia. Kasi kapag may nakausap sila or may social interaction sila, nagkakaroon sila ng distraction mula sa mga negative or scary thoughts nila. So may mga studies pa nga na nagsasabi na nakakatulong yung social interaction para ma-rationalize nila or para ma-question nila yung mga maladaptive thoughts nila na parang hindi healthy. So syempre, hindi naman pwedeng sobra-sobra kasi iba-iba yung tolerance ng bawat isa sa social stimulation. So pwede silang turuan ng less drastic ways para mag-disengage, like pag-step out muna ng room for a few minutes or di muna magsalita or kahit lowering their gaze kapag feeling nila na sobra na. So by this, nakokontrol nila yung social situation at hindi sila totally nag-withdraw. So mas confident sila na pumasok ulit sa group kapag ready na sila. Next we have is the belief modification. So isa to sa pinaka-interesting coping strategies na tinuturuan sila na i-question and challenge yung sariling beliefs nila. Lalo na yung mga paranoid or delusional beliefs. So for example, kung may belief sila na may nagsisipya sa kanila or may nagmamanman, tinatanong sila ng therapist like, ano ba talaga ang evidence nito? Paano ba pwedeng mangyari yun? So may ibang possible explanation ba? So ganun sila parang in-encourage na mag-isip ng iba't ibang perspectives. So marami naman sa kanila ang kaya naman nagawin to. Pero syempre, kapag sobrang stress or isolated sila, minsan nagiging mahirap talaga i-apply ng maayos to sa sarili. So kaya yung goal is maging automatic na to na parang self-regulatory process. So kapag may mga suspicious or paranoid thoughts sila, tinitingnan nila agad kung valid ba yun or kung may iba pang mas reasonable explanation. So next is the reality testing and behavioral experiments. So sa mga coping strategies, isa to sa pinakamalakas kasi tinutulungan nila yung patients na i-test ang beliefs nila sa actual na buhay para ma-challenge ang delusions or paranoid thoughts nila. Kasi sa halip na laging umiwas sa mga sitwasyon na nakaka-trigger ng takot or paranoia, tinuturuan sila na gumawa ng maliit na experiments or behavioral changes na safe para ma-observe nila kung totoo ba talaga yung fear nila. So for example, kung may takot silang may nanonood sa kanila, so instead na laging umiwas or mag-overthink, pwede nilang subukan i-test yun sa paraan na safe. Like maybe maglakad sa isang place na medyo crowded pero controlled, tapos i-observe nila kung may nangyari ba talaga o kung nagkamali lang sila ng interpretation. So kapag walang nangyaring nakakatakot or threatening na event, pwede nilang gamitin yun para i-challenge yung belief nila. So mahalaga ito kasi kapag palagi silang umiiwas, lalo lang lumalala yung paranoia or yung takot nila. Tapos kapag naging kapag nagiging mas matindi na yung symptoms nila. Kaya ang effective na paraan para ma-shift yung thinking nila ay yung pag-experience mismo ng reality na of course in a safer way, at makita nila na hindi palaging totoo yung mga negative thoughts or yung paranoid thoughts nila. Lastly is the enhancing coping strategies. So at the end of the day, ang pinaka-effective na coping strategy is yung pag-combine ng iba't ibang methods na ito. So lahat na na-mention ko kanina. So parang step-by-step process siya na progressive. So una, pwede mong turuan sila ng attention switching para ma-lessen yung emotional impact ng symptoms, para di agad ma-overwhelm ng mga voices or delusions. So then kapag medyo cool na sila or medyo kalmado na sila, pwede naman gamitin yung de-arousing techniques para ma-calm down sila ng mabilis, like deep breathing or simple relaxation. So kapag kaya na nila yan, saka mo sila ma-encourage na mag-try ng reality testing, kung saan tinetest nila yung mga delusional beliefs nila sa real life para ma-challenge yung mga unhelpful thoughts. Tapos as part ng therapy, pwede rin i-prompt ng therapist yung mga tanong na para ma-reflect sila, like, alam mo ba na may control ka na sa voices? Ano ba ang ibig sabihin nun sa'yo? So para ma-build yung confidence nila na kaya nilang harapin yung sitwasyon, hindi sila totally helpless. So overall, yung mga coping skills na to ay nakakatulong para ma-develop yung self-efficacy nila. So yung sense na kaya nilang i-manage ang symptoms araw-araw, lalo na kapag lagi nila itong pinapractice and pinapa-improve. Kaya kahit mahirap, may pag-asa talaga na mas maging manageable ang schizophrenia kung matututunan nila ito, like yung mga techniques. So we're now on to our last topic, which is the modification of cognitive content or cognitive process. So usually, ang therapist, either pinapansin nila yung content, like anong sinasabi or iniisip ng patient, or yung process, which is kung paano nagpo-focus or paano yung attention ng patient sa mga thoughts or voices. So traditional na therapy, mostly content focus. Pero dito sa coping model, we try to work din sa process kasi madalas may problema din sila sa attention or control ng pag-iisip. So why do modify cognitive processes? So alam nyo, ang advantage talaga dito sa modification of cognitive process is that mas flexible siya compared sa usual na focus lang sa content ng thoughts. Kasi hindi lang yung specific na laman ng utak ang binabago. Kasi pati yung way nila mag-isip or mag-focus. So halimbawa, kapag nakakainis or nakaka-stress yung voices na naririnig nila, imbis na diretso nilang labanan yung content, tinuturuan sila how to switch attention. So parang redirect lang, parang di na masyadong maapektuhan emotionally. So parang quick fix yan para ma-calm down sila agad. So mas nagiging practical siya kasi pwedeng gamitin kahit hindi pa ready i-challenge yung beliefs nila. Plus, dahil sa mga attention and executive function deficits na madalas kasama ng schizophrenia, mas effective yung approach na to kasi tinutulungan nila yung utak to handle or regulate its own process. So, how cognitive content and process work together? So, usually, it's not parang pili ka lang between content or process. They actually work best together, as in parang tag team sila. So, minsan mas okay mag-start sa cognitive process like attention switching muna. So, kunwari, natatakot siya kasi may naririnig siyang voice na threatening. So, instead na i-confront agad yung message, turuan muna siya how to shift attention like sa environment or even kahit sa ginagawa nila. Tapos, once medyo kalmado na siya, doon na papasok yung cognitive content part. Like, i-question na kung totoo ba talaga yung sinasabi ng boses na naririnig niya. Kasi kung kalmado na yung utak, mas may space na to think logically and challenge the belief. So, ganito siya mag-work, step-by-step process. So, process helps lower the emotional intensity, tapos content modification helps with long-term insight and change. So, ang goal is hindi lang basta mawala yung distress, kundi matutunan nila paano i-handle to in moving forward. Meron tayo ditong real-life example. So, let's say na may isang young guy na diagnosed with schizophrenia. So, nakakarinig siya ng voices na sinisisi siya na siya ay isang murder. So, it's very intense, no? So, sinasabi pa na isa siyang Russian, which is weird kasi hindi naman siya Russian. So, ang unang step dyan is to teach him na he can actually shift his attention from the voices. Like, instead of listening or reacting sa sinasabi ng voices, pwede siyang turuan ng techniques na makapag-focus siya sa isang bagay. Like, deep breathing, sensory grounding, or kahit simple distractions lang. So the goal is para hindi siya ma-overwhelm agad. And then, once na kaya niya nang mag-focus at hindi na siya ganoon ka-stress, doon na siya tutulungan mag-question ng content ng mga hallucinations niya. Like, hindi ba obvious na hindi siya Russian? So maybe mali rin yung sinasabi ng voices, parang ganun. So step by step, natututo siya na hindi lahat ng naririnig or naiisip niya is automatically true. So it builds his confidence, tapos nagkakaroon siya ng sense of control over his symptoms. So parang hindi na siya prisoner ng hallucinations niya. Siya na yung may power kung paano siya mag-respond sa hallucinations na yun sa mismong kagustuhan niya. By working both on how patients focus their attention and on what they believe, therapists help them gain control and challenge their symptoms in a flexible, effective way. And that's all for this discussion. I hope I provided you new learnings and insights for this subject. Once again, I am Rahadia M. ULANGKAYA from BSSW3C, the second reporter of Group 14.